Good evening, everyone, and thank you for joining us this evening for our COVID-19 Town Hall. My name is Jason Molino. I'm the County Administrator here in Tompkins County, and we've been advertising this for about the past week and have had a lot of questions come in around the vaccine, around vaccination process, also around testing and how we're doing in the county. And we're going to get right into those questions. Before we do so, I want to introduce who I have with me today. I have Dr. Martin Stallone, Cayuga Health System CEO, Frank Krupa, our Public Health Director in Tompkins County, and Amy Hendricks, our Deputy County Administrator, who's also been our Emergency Operations Center Manager. She's going to be assisting as she and I ask the questions of both Frank and Dr. Stallone as we go through this. Don't want to give too much of an introduction, but I do want to say a few words before we dive right into the questions. First off, we're balancing two major initiatives right now. For the past 11 months, we've been balancing disease surveillance and disease management, cover your face, keep distance, minimize density, good personal hygiene. And now we are in the process over the past several weeks of administering vaccine. And they both go together hand in hand. One doesn't start and one doesn't finish. I think we want to stress that as we go through this. While we continue to distribute vaccine and administer vaccine to the community, continuing to stay vigilant on disease surveillance is critically important, and we want to make sure people don't get complacent with that. Yesterday, unfortunately, we had a 50 case day. We probably come close to it again today, just to go to show you disease surveillance is still critically important as we begin to roll out this vaccine. Before we get into some of the more vaccine-based questions, I do want to talk a little bit. I have some questions both for Frank and Dr. Stallone regarding case increases, and unfortunately, while we have had few in this community, some deaths that we've experienced. Frank, I'm going to start with you. We've seen a consistent rise in cases in Tompkins County. What is the current prevalence of the disease and what is contributing to the spread?
Thanks, Jason, and thank you to everyone for tuning in. Our cases are growing. We had a 50 case day yesterday. We're going to exceed that today as well. This is kind of the window that we expected. We might see an increase related to the Christmas holiday. And so, it's not wholly unexpected, but, we had hoped we might not see these types of increases. I think probably one of the most important things we have to talk about is we've seen more people in the hospital. And we've seen more people in the ICU, and unfortunately, we've had the tragedy of death here in our community. And all of that, those follow hand in hand, right? As we have more cases, we're more likely to have more hospitalizations and those tragic outcomes. So it's really important, as you said, to continue to follow the public health guidance, mask wearing, distancing, hand hygiene. And I'd also say you were talking about, kind of the things we've been doing over the last month. Testing is a huge part of that as well, right? And certainly Cayuga Health Systems is a big part of making that a reality for us here locally.
Thank you, Frank. And you mentioned hospital, and Dr. Stallone, maybe you can provide a few more details on the current hospital capacity. We've received a lot of questions about the Cayuga Medical Center's capacity. Can you share with us, what does that look like from your perspective, and how's the hospital doing?
Sure, Jason, I'm happy to. And I want to echo the thanks for signing in and listening to this, and hopefully we can get through most of the questions. Certainly our job is to provide available hospital capacity to the community. That's what we think about a lot. Before I go into any great depth about that capacity, I just want to recognize, because a lot of our staff will be listening to this tonight, our deep appreciation for what they do. Staffing and capacity is not a static metric. It is changing, and it depends on humans being heroic and coming to work, sometimes doing extra. And we're really appreciative to all the healthcare workers that have stepped up and done more than their fair share, I would say, in this community. I want everyone to know in the community that we're doing very well with respect to hospital capacity. As I say that, I don't want people to infer that we can be frivolous and careless with our personal protective measures and our disease containment, as Jason was saying. But the fact is that this community has invested in a capable hospital system, and its administration, its board, are working hard to make sure that we have enough capacity to meet the need. We're watching this very closely. We're doing a few things that I think should give comfort to the community. One is we are actively working with hospitals in the area, really across the whole southern tier, to load balance if and when that happens. That means reciprocally, we may be asked to take patients if another hospital is getting into trouble. Similarly, if we lose available beds or come close to a limit, and we always act well before we reach any kind of limitation on our capacity, we can transfer patients to other hospitals. Thankfully, while that is an option, we have not needed that to any extent. We have accepted patients from other hospitals in our region, but we have never come close to having to transfer patients. On a daily day, we actually communicate with the other hospitals and the state, and we report our hospital capacity. So we count the number of beds that are staffed on a daily basis. I wake up in the morning around 6 o'clock and our team is already calculating what we have, and they're communicating that to other hospitals and the state. And we're very happy to say that right now we're at about a 55% capacity. We've grown our denominator. We've expanded the number of beds. But right now we have 132 available medical surgical beds. And just to give you a sense of what we're using about 73 of them. And so we are paying extra. We're actually making staff available so that if and when patients come into the emergency room and need admission, we'll be ready. Again, I hasten to say we don't want to use this capacity. This is really a buffer. We also calculate with the state what we can grow to in a 3, 7, and long-term horizon. And we communicate that as well. And we've actually grown the number of ICU beds we can create in 3 and 7 days. And we also have somewhat of a disaster plan that if we needed to go way above that, we could grow well above 200 beds if we needed to. If we did that, we'd need to curtail services, and we don't want to do that because what the state considers to be elective is not always discretionary for people who are receiving those services. So anyone who needs orthopedic work and they're suffering pain, for instance, we want them to be able to have those services. Cancer screening, we want to be able to operate as a health system, but we need to reserve capacity. So very delicate balance, good capacity, good supplies. We get questions about PPE levels. We maintain a 90-day supply, and we calculate what we use on a daily basis. So this is something that we're working very hard on and watching very carefully on an ongoing basis. And I'm happy to answer more questions if there's something I didn't touch.
Thank you, Dr. Stallone. Appreciate that. We've both touched on it, and we've had little in the community. We have had experienced some death in the community as a result of COVID. Are nursing homes required to report the cases to the department? Does the health department publish COVID positive case data for all of the nursing homes?
Yes, all of the nursing homes in Tompkins County. So when a test is collected, it's sent to a laboratory. Every positive result is required to be reported into the state laboratory database, and then those are sent to us here at the health department. So if someone is a resident of Tompkins County, and that includes individuals that are in a nursing home, those positive cases are reported to the health department. Once we identify that the person is in a nursing home, we then turn that case over to the New York State Department of Health, but that case, that positive case is counted in our daily numbers. So all nursing home cases are counted in our daily numbers reported.
Great. Thank you, Frank. Dr. Stallone, once cases are identified in nursing homes, what happens to help stop the spread from causing deaths? We've seen a significant increase in deaths locally over the past month, particularly in nursing homes. Can you shed any light on that for us?
Yes. So I'll start by saying we actually have a nursing home in our system, Seneca View, and so we have personal experience with COVID positives in that setting. First, there is a fairly rigorous expectations on infection control in any SNF, skilled nursing facility. I will tell you the state is actively surveilling and inspecting these facilities, particularly if they see through the data reporting that Frank mentioned that there are positives. They come in and make sure all the infection controls are in place. So these are things like not only having adequate PPE, but the staff using it appropriately, segmenting patients who are positive where possible. It goes without saying, we watch those patients very carefully in the nursing home setting because we understand oftentimes they're frail and vulnerable and can deteriorate. If in our system, if there is not capacity to do what's necessary for those patients, and we think that that might overwhelm the system, we actually have brought patients into the hospital for the extra care. Another topic we might touch on in time is that actually has put an extra burden on the hospital, but that's where the most substantial resources are. So SNFs, if there's a question about capacity and infection control, they can call upon the hospitals as a last resort. But effectively, people become very, very careful and vigilant about good infection control practices, are inspected as such, and then watch those patients very carefully for the complications of COVID.
Dr. Stallone. Amy, I'm going to pass over the next series of questions to you as we're going to now get into vaccines, the vaccination distribution process, administration process.
All right, thank you, Jason. So we have received dozens of questions from individuals throughout Tompkins County, and they are looking for a lot of information. They want to know how they can be vaccinated, when they can expect to be vaccinated, and many have provided pleas for us, asking about their family and loved ones. And so we've heard dozens and dozens of stories of people really wanting to know when it'll be their turn and how they can protect each other. And I think one of the main messages and takeaways from tonight is we're going to ask people to be patient. We're in this for a little while longer, and both the health department and hospital are doing a lot to help get the vaccine into our community and make sure that we are continuing to watch that disease as well. So I'm going to be asking a series of questions for both you and Frank about the vaccine, and also ask people to continue to note that while vaccines are being made available, it does not mean we're at the finish line just yet. It's really important that all of us do continue to wear masks and keep the distance and check in on each other. I think that's a big piece, is as we talk about keeping distance, one of the big things you can do is just continue to check in on one another. People are going to start receiving the vaccine in our community, and we're going to continue to provide a lot of information from Tompkins County to our community. Dominic Recchio, who's our communications director, is actually going to put a link in the YouTube chat for people who want to continue to receive updates. They can put in their information at that link, and we'll continue to provide information back out to the community regularly. So we want to hear your questions. We want to help answer those questions. And as we continue on this evening, you're going to find out that we don't have all the answers, but we'll give you our best attempt to find the answers and give you the information as we have it. So with that being said, I'm going to dive into our questions, and I'll just remind you both that we have a lot of questions. And so brevity on the answers is very important. So I'm going to start, and this one's actually both for Frank and Marty. So Frank, I'll start with you, and then Marty, I'll switch to you. How confident are you both in the safety of these vaccines? And what information are you basing your own assessment on? So Frank?
Sure. Brevity's not my strong suit. Sorry, Amy, I'll try my best. Yes, I am confident in the safety of these vaccines. They go through a vigorous process. While it may have seemed fast, it was still a complete review by the federal government through trials conducted by the manufacturers that are then reviewed by experts at the federal level. New York State did its own review once the vaccines got federal approval as well, and the experts there signed off on it. Vaccines are a key public health initiative. We've been using them to try and eradicate diseases for decades, and this is just another opportunity for us to use the science that we have to help us combat disease.
In the interest of being brief, I'll just add on that these were scientifically studied. Those scientific publications are now available for your review if you wanted to review them. There's very identifiable side effects that are not unexpected and consistent with other vaccines: pain, redness, local swelling. There's less common ones such as fever, headache, fatigue, and none of them really rose to the level of causing hospitalizations or what are considered serious adverse reactions. So based on the studies, it is a fairly safe vaccine, and everything is risk and benefit in medicine. And when you put in the efficacy benefit, which I didn't see a lot of questions on, but a 95% effective vaccine after 2 doses, 7 days after the second dose, that is a substantial risk decrease that has to be thought about with relation to the safety profile of the vaccine. It is as everything in medicine, a risk-benefit analysis.
Great. Building on that, for the safety of the vaccines, for someone that's immunocompromised, how safe are the vaccines for someone with a condition like a kidney disease or something like that? Marty?
I think they're safe. They weren't studied particularly in immunocompromised populations. I'll add one on to that. In pregnant women, it's a very common question. The mechanism of the vaccine, an mRNA that makes protein, and then your body makes a immune response to the protein, which is part of the COVID virus. It may be in immunocompromised people that they can't generate an equivalent immune reaction, but it's not going to hurt. It wasn't studied. And it is in all of these questions, and I know we'll get into some questions about what about this and what about that. These are what the medical establishment is for. I don't want this forum to be in between the audience and their professional medical providers, but seems to be safe, but the efficacy has not been studied, but better than nothing.
All right, thank you. Moving into some of the timeline questions, and actually, Jason, I have a question for you. Some people of color and other folks around in our community have been historically marginalized groups, have expressed a lot of skepticism about receiving this vaccine. How do we help these communities build trust in the vaccine and our own vaccine distribution system?
It's a good question, and it's a lens that I think we've looked through and tried to look through as we've gone through the testing process to ensure that it's accessible to everyone. We take on a special and a specific effort to educate our populations. We try to hold meaningful conversation and dialogue with our different groups in our community to educate them about the safety, the efficacy of the vaccine. That's incredibly important that we're able to educate our entire population and different groups in that population to do that. And it's a concerted effort that we have to make to build that trust. And we use our community networks and our partners to do that as well. And I think we recognize that people of color have been disproportionately impacted by COVID in general, and we want to ensure that we make access to this vaccine as easy as possible to all of our members of our community. So one of the things that, Frank mentioned about as we come up with challenges, we come up with solutions. We have one site open right now for vaccinations. We'll probably do more, and we'll probably look at transportation methods. We'll look at access issues and concerns. So it's a constant work in progress. We recognize it, and we want to ensure that all of our constituents and our residents that want the vaccine have access to it.
All right, thank you, Frank. More on the actual timeline. What is the timeline for vaccine distribution here in Tompkins County? Dr. Sloan?
Sure. We are in what is considered phase 1A. That is the forward-facing high-risk healthcare workers and other individuals who by their role come into contact with COVID-positive patients. That is actively ongoing, and we have size estimates of what that population is, but we're actively conducting community clinics. Hopefully people have heard that we have set up a large-scale vaccination clinic at the Shops at Ithaca Mall in the old Sears space that is designed to be able to deliver 1,000 vaccines, and at that rate per day, 1,000 vaccines per day. Today, through Friday, we should be at the 700 per day mark, and then depending on allocation, we can continue, and we would exit phase 1A at some point, pending permission and say so from the state. And that's an important point, is the state makes the rules in terms of what phase we're in. So we can't speak to exactly when we would get out of that phase, but I do want to make the commitment to the community that the distribution system, in cooperation with the Public Health Department as the health authority, will stay ahead of the distribution and the amounts of vaccine we get, meaning we will not be the limiting factor. And so we're gearing our operations for that. And as soon as we get the vaccine and are permitted by the state to give it, we will do so.
Right. And as Dr. Sloan just said, we're in group 1A. So Frank, who's in group 2 and when does group 2 begin?
Sure. So let's right size the language. We're calling them phases. Well, the state is calling them phases. Phase 1A, B, and C, and then phase 2 and 3. So we're going to be using that language as we move forward. So we just want to be clear about that with folks. Phase 1A, as Dr. Stallone said, we're in right now. Phase 1B will move to essential workers and those individuals over 75 years of age. The question that everyone wants to know is who's an essential worker? We don't know just yet. We imagine first responders, utility workers will be included in that. But as Dr. Stallone said, the state is setting these criteria. They're doing it week by week. The important thing for our community to know is that as soon as we know that who is now eligible, you will find that information on our webpage. And as Dr. Stallone said, we're going to try to make sure that we're ready, assuming we have vaccine supply, that the minute someone is eligible, if they want to get vaccinated in Tompkins County, they'll have a place to go to get vaccinated.
So Frank, just a clarification on the essential worker guidance. Who determines that piece? Who, just to make that very clear, once essential workers are allowed to get the vaccine, who will determine who the essential workers are?
Sure. So that will be done by the state. They will tell us who are in those categories. I can tell you in phase 1A, there's been a proof of employment requirement as part of the pod process. I would assume that will likely carry over to 1B. So the state will say who is eligible by profession. And then when they will need to attest to that when they register, and likely will have to bring some basic proof of employment in that field.
So another question on this phase piece. If someone is in phase 1B or phase 2 and doesn't get the vaccine because of whatever reason, do they then have to wait till it's open to the general public? Can they go at any time? How does that work, Frank?
Yeah, it's really important to point out that once you're eligible, you will be eligible in any pod that we offer in the future. So when we add new people to the eligibility, we're doing just that. We're adding to the already eligible population. So you won't miss your spot in line if you don't get at the very first clinic when you're eligible. As soon as you're eligible, you could sign up for any clinic in the future where we're offering pods, where we're offering vaccines, sorry.
All right. And I'm going to go back to you, Dr. Stallone. For older adults, those over 65 who have pre-existing conditions, when do we expect them to be vaccinated, and what will their process look like?
Yeah, I think the when vaccinated is covered, and we don't know exactly. I mean, we'll go through the order, and as soon as they get opened up, we'll dispense it. But what will it look like? I've thought about this. There's rules, and there's rules put on the healthcare system, the people giving the vaccine, and there's rules put on the individuals receiving the vaccine. So I think that will be similar. It will probably involve an attestation by the individual that they meet the criteria. Alternatively, it might require a physician or healthcare provider attestation. Operationally, I would acknowledge that is complicated to actually get physicians or other providers to actually give orders to people, and then we check the order. I would expect, based on the rate of administration I'm seeing in states around us and other systems, that it would be an attestation. And one possibility is that might just open up very quickly into a more general age-based access. But that is it's for the state to say.
Okay. Thank you. I'm going to turn it back to you, Jason, to ask some additional questions about accessibility.
Thank you, Amy. Thank you. Accessibility of the vaccine. Frank and Marty, this is for you. Frank, why don't we start with you, and then Marty, I'll have you answer as well. What accommodations are being made for people with disabilities?
So the pod is accessible. Is ADA accessible. It's in a building that is ADA compliant at the old Sears building in the mall. Public transportation is available to the site through both TCAT and Gadabout. And we are ready and prepared to serve anyone that has disabilities that comes to the pod.
Thank you. Thank you.
Sure. I'll just add on to that. There's site-specific considerations for disabilities and navigating the local situation, and then there's immobile populations that have to be accounted for. And there's a federal program that reaches nursing home individuals, and we are aware that not everyone can get to the site, even with provided transportation, and we are addressing that on a case-by-case basis. We're working with the organizations for which that is a reality. We've had some success. I want to brag a little bit that we've had some success on some pilot programs that are unique to the state, and we're actually a model that they're looking at for how to do that. So again, good work being done locally, and we're aware that this is an issue.
Great, thank you. Frank, how are individuals notified of their phases?
So the most important thing that we're trying to get folks to remember is to look at our website, and because there'll be the most up-to-date information there about who's eligible as well as how to register. We absolutely understand that not everyone has access to the internet, and so we will also be doing other forms of outreach depending on the new eligibility population as it's added. Everything from the robocalls that folks have heard probably tired of hearing from me, as well as doing some targeted media and other efforts to our public information folks. So we're not just going to rely on the internet, because we recognize that some folks don't have access to it, but that is the best primary first place we'd ask people to take a look to monitor how the eligibility is evolving.
Great, thank you, Frank. And I think I'll add to that if I can, based on the question Amy had asked me about our vulnerable populations and our underserved populations. In terms of phasing, we're going to do our best to communicate to ensure that all members of our community, people of color, understand the phases and where everyone lies in those phases, and we'll do the best we can to continue those conversations with our community members. We understand that certain members of the community have been disproportionately impacted by COVID. We want to ensure to build the trust that this vaccine is safe, they have access to it, and how to access it. So I just want to build on that and our continued efforts to communicate to all members of our community. Dr. Stallone, can you talk about how are individuals in the phases identified and by whom?
Again, the phases are defined by the state, and then there's a combination of the individual attesting to being in the phase, and then in some cases there may be external verification. So Frank mentioned proof of identification. Certainly when we were doing hospital workers, hospital ID was necessary. Interestingly, other hospitals received vaccine and vice versa. We received other vaccine for other hospitals, and when individuals showed up, they were typically on a list and showed proof of identification, proof of employment. And so there's usually some effort. The question is, to what extent is that effort spent to make sure that people are in the group? And in most cases, it involves a personal attestation.
Thank you. Thank you. Frank, what's the current bottleneck for rapid distribution in Tompkins County? Are we on track to distribute all our vaccines before the expiration dates or as soon as possible? If not, is there, the second part of that, if not, is there anything non-healthcare workers can do to volunteer and help speed up things?
So again, probably going to go a little off script here. I think what the biggest bottleneck for us is going to be is people coming to get vaccinated, right? We have eligible populations right now. We have slots that you could go on right now if you're eligible and sign up for tomorrow or Friday and get vaccinated. That is what's going to hold us back from getting all of our vaccine distributed, is that we need people in the eligible population to come out and get vaccinated. That is the most important thing. As Dr. Stallone said, we are prepared to outpace the amount of vaccine from an administration perspective. And so our really what we need is for folks to come and get vaccinated. Now, as far as the flow of vaccine, obviously it starts at the federal level because they're responsible for distributing all of the vaccine that's being made. So it's coming in small batches, small is relative, right? In batches each week to the states. And then the state is distributing it out to those of us that are doing the administration. So obviously it's going to take a little while to get enough vaccine for everyone that's eligible. But right now I can tell you we have slots available tomorrow and Friday, and we really need folks to come out, get vaccinated. We want to use up every single vaccine that we have. So we need everyone in those eligible populations to come out.
And Frank, if I may, where can people that are in those phases where do they register?
Sure. So the health department website, we have a vaccine page. Just go there. It has all the eligibility requirement as well as where you can click on to register. The state has also developed this new tool where you can put in your information and determine if you're eligible. That will then, if you are, push you back to our webpage to register. So there's a lot of information on that vaccine page, and I would encourage folks to take a look at it.
Great, thanks. And we will put the link to that in the chat box on the YouTube video here.
I'll just add, Jason, if you don't mind, we are, because part of that question was asking about what could be done to expand the number of vaccinators. At some point, we will need more people, and the efforts are underway to plan for that. Again, I think we're a little far off in terms of general population wide open, but when that happens, we are making preparations with partner organizations to make sure that there, as Jason alluded to, are other sites. And so again, we're going to stay ahead of the supply. again, everybody needs 2 doses of the current vaccine. So if you think of Tompkins County as 100,000 people, we need to accomplish 200,000 plus vaccinations to reach everyone. So that is going to be a much more monumental effort than what has been done to date. And we're thinking about that.
Thank you, Dr. Stallone. Frank, we've heard from some individuals who express that they are feeling guilty about getting the vaccine early in the process as they have older parents or grandparents who are at higher risk. What would you share with some people who are feeling this guilt?
Yeah, we've heard that several times from folks. And what I would say to them is don't feel guilty, go get vaccinated. How you're going to help the people that are not yet eligible is by getting vaccinated and limiting an exposure point for them. Right. So it's going to take us time to get to everyone. We're going to move into our older populations here in the coming phases as we move forward. But please, if you're eligible, we have vaccine. We want to get that vaccine administered to you. And that's how you're going to help those folks that are not yet eligible. One less place that they can get it, that they can catch COVID from. So don't feel guilty. We're there for you. We want to give you that vaccine. You're eligible. Please come.
Thank you. Marty, are any second doses for those who received the first dose being delayed? There are some discussion in the national media of adjusting dosage to help with the distribution.
Yeah, not necessarily delayed or held back. So we didn't know this at first, and that was a question. When you give someone a dose, do you, whether in the case of Pfizer 3 weeks or Moderna 4 weeks, do you hold the second dose to make sure you can do that? We've been instructed very clearly not to do that. So we give, if we get 1,000 doses, we give 1,000 doses. If it's the first dose, those 1,000 individuals will need a second dose, and we are relying on the federal and state allocation process to make sure there is vaccine when their turn comes around for the second dose. There is talk if there is an insufficient supply, because there is some efficacy gained by the first and only dose given, but so far that has not been decided. It's not that it's implausible, but it's not how we're told it's going to work.
So I have a follow-up question for Frank or Marty. I'm not sure who wants to answer this. Is if doses are not signed up for, what happens to them? How do we handle that if we have additional doses and no one's there to get them?
So a little bit on the operational side, Frank, I'll take this. So we always keep in mind who else is on the list and next. So we're looking at, if we have 700 people to vaccinate in a day, we understand who the next 300 are unscheduled. In the hospital, when we were giving this out, we were able to identify other people to come. So wasting a dose of vaccine is unconscionable to us, and we do everything within our power to make sure that that doesn't happen. So we're planning, there are refrigerators on site, there's a pharmacist on site to allocate it very carefully, and there is no waste going on.
Thank you.
Dr. Stallone, once we've received the second vaccination, how long does it take for our bodies to develop immunity? How long before we can begin to feel relatively safe from COVID-19?
So reasonable question. I would say that the immunologic response to the first vaccine is already working. So it doesn't turn on after the second dose, but the second dose boosts the efficacy that I referenced. So the study showed about 50% efficacy after the first dose if the second one wasn't received. And then the studies were designed that 7 days after the second dose, you got to the 95% efficacy mark. And it was really kind of straight line to that point. And so that's why the second dose is important with this kind of vaccine that's been approved, which is the Pfizer and the Moderna.
Great, thank you. That's a good part. We've had that a few times, Dr. Stone.
Yep.
Fine. This question comes in. I'm concerned about the possibility that the soon-to-be vaccinated portion of the public may believe they cannot transmit the virus and stop taking safety measures, mask wearing, distancing, washing hands, etc. What should people who do receive the vaccine do after being vaccinated?
They need to keep doing all of the public health guidance that we've asked them to, the mask wearing, the hand washing, the social distancing. And the reason for that, there's a couple of reasons. One, no vaccine is 100%, as Dr. Sloan just mentioned. 95% is an amazing efficacy level, but there's still 5% of people that will get vaccinated that could contract the disease. And we won't have herd immunity for a while. right? So we need to continue to protect those vulnerable populations that we've been protecting all along. So we're going to ask people, even though they get vaccinated, to continue to follow that public health guidance. And we still don't yet know about transmissibility with the vaccine. We know the vaccine protects the individual, most individuals from getting sick, but we don't yet know. We just don't have the data yet to know if it prevents transmission of the disease. So for all of those reasons, we need everyone to get vaccinated as soon as possible, but until we get to a point where we have that herd immunity, we're still going to be asking people to follow the public health guidance.
Okay. Thank you. I'm going to shift a little bit to site logistics around probably vaccination sites. So Frank, this first question for you. Is there a list of all the sites in Tompkins County where the vaccinations will be given? Should patients go to the Tompkins County Health Department website to sign up, or will each site have its own separate sign-up system?
So yes, as long as we're operating points of dispensing, those will all operate through the health department. And so our website will be that point of location to register if there are additional sites. What I will tell you for the near future, we're going to be using a single large site at the mall that's already been set up, because that's the most effective way for us to get the most people vaccinated. As it becomes more available and we're dealing with the greater population, and as you said, Jason, we're trying to reach some of those harder to reach populations, we will likely be going to smaller sites, throughout the community to make the vaccine available. If they are run through the pod system with us in Cayuga Health System, the registration will happen through the health department. If the process starts to include more private sector entities like pharmacists and other areas, where we will do our best to provide information about where those are on our website, but you might have to go to that facility for registration. That's probably a ways down the road, but I will just reassure everyone that I want everyone vaccinated. I can't wait till I'm not doing a daily report about how many cases we have, and our staff can get a rest. Those amazing staff Dr. Sloan was talking about, they need a break. We need to get people vaccinated so we can get back to as normal as possible. And so I'm going to do everything possible to make sure everyone knows when and where vaccine is available. And like I said, our bottleneck is going to be getting people to come to where we have vaccine available. So please keep an eye out. We're going to blast everywhere we can when we have vaccine available, and who's eligible. If you're eligible, go get it.
Great, thank you. To kind of build off that, and today was one of the first days that we had a larger vaccination administration. Will there be appointments for people so that they're not waiting in line for hours?
I'll take that. We're evolving in this process. So today was our biggest day so far. We had a 388 dose vaccine day last week as our first shot at this. We're now at 700. My team tells me that went today. We know the lines were a little bit long, and we were very glad that it was above freezing outside, because if they did extend outside. We're committed to making this a smooth process, and I mentioned that we're sizing this so that we can deliver, at least 1,000 vaccine doses per day at that site or more. And so we do offer appointments. There are appointments. I would ask people to come kind of close to their appointment time, because that smooths out the arrival and eliminates bottlenecks. But there are appointments. There will be more appointments, and we calculate our capacity based on how many people per hour we have to serve.
Jason, could I just emphasize a point Dr. Stallone just said? I was at the pod today working to support the vaccinators, and we need folks to respect their appointment slot as much as possible. There will be a little bit of a wait when you get there, and I hope folks will be patient with us. But if we're not respectful of those appointment slots, it makes those waits longer, and it makes it harder for us to manage trying to keep those waits as short as possible. So please be as respectful as possible of the appointment slot that you signed up for.
Thank you.
Thank you. Dr. Sloan, I want to go back to you just on the site. What are the guidelines for administering the vaccine to people in their cars?
There are CDC recommendations about this kind of a model. I would point out that there are difficult logistics with it, particularly in Ithaca in the winter. There's an observation requirement for about 20 minutes. And so there's also the idea about staff being outdoor if there is weather issues. So is it plausible? It could be done operationally, and it would be in opposition to getting as many people through the vaccination process as we can. It would be very difficult in a true drive-through to accomplish, with our means today, 700 people per day. And we want to grow that number. So there are guidelines. They're on the CDC website. I think it's billed as considerations for drive-throughs, but we will not be doing that presently.
Okay, thank you. If a site is chosen as a vaccination site, are doses that go to that site specific, or can they be moved to other sites? Who determines this? I don't know if this is a Dr. Stallone or a Frank question.
Well, a little bit of both. I mean, effectively, it can go to a site. It would be allocated for someone else. That has happened. We've had it where staff from the different organization come to us. In the case of hospital, there is a reallocation or a distribution process, and that is a state granted permission that happens. And so, for instance, I think, Frank, technically you reallocated your vaccine to us to distribute under kind of your supervision and authority, but that was a permission that you got from the state, if I'm not mistaken.
Correct. Yeah. So the federal government, in order to distribute or administer vaccine, you have to register with the CDC. And we did that weeks ago. And you put in your location. If you're going to change the location that the vaccine is distributed to, you have to get permission from the state and the federal government to do that. What we are able to do is, so Dr. Stallone, the hospital has accepted our allotment, the local health department allotment. They're able to take that vaccine to the site for administration for those purposes. But if they wanted to say give that to another hospital, they would have to go through that same process of getting state and federal approval to do that. So it's not simple to move between, but it can be done. And certainly it is part of the plan to make sure that we can get everyone across New York done in phase 1A so we can begin to move on to the other phases.
Great, thank you. Frank, is the health department and the hospital communicating with primary care physicians so they can help distribute this information to their patients?
Yes. Go ahead, Marty.
So, I mean, we exist within a clinically integrated network. We hounded them. We emailed them. We called them. I texted them. Our medical staff texted them. They are very well aware, and they were told to hound their people to go and get the vaccine.
Great. Thank you. This one's for you, Frank, and then the next one's for you, Marty. Frank, what considerations have gone into selecting the current vaccination site? Have outdoor spaces and gymnasiums been explored as options?
Yeah, so we have a medical countermeasures plan that we've been working on for the last 2 decades that we've put in place for just this event. And that comes with identifying appropriate sites around the county that we might use. Yes, we've talked with the school districts about the availability of gymnasiums if we needed them. Our higher education partners, we have facilities located there that we could use if we needed to. The hospital has this relationship with the mall that has large open vacant spaces. And so economy of scale by having testing and the vaccination all there together creates efficiency. And so this is really a win-win-win to have that location available right now. But we definitely have other places where we have memorandums of understanding that as we move forward, if we need to find other locations to spread out across the county, we would be able to do that.
Thank you. Dr. Stallone, how has the hospital and the county made sure that doses of vaccine do not spoil and have been stored properly?
Sure. I mean, we have professional pharmacists that are wonderful who do this. They have special training in cold chain management. The Pfizer vaccine does require a freezer that goes to Arctic temperatures. I think the fridge, when I walked by it, was at a negative 113 degrees Fahrenheit. So we stored it properly. It was received carefully. It was stored carefully, and it's distributed when there's members of the community who need it. And there's pharmacists managing that whole chain right up to including at the mall.
And Jason, if I could just jump in, I think this is another time to just talk about the partnership that we have with Cayuga Health Systems. We are so thankful. We would not be able to do this if we weren't working together. for me to receive 1,800 doses would have been a monumental task. We have small fridges and freezers for small amounts of vaccine that we use at the health department. Dr. Stallone has a team of professionals that this is what they do. They have the systems in place. They have all of the equipment that's necessary, and this is what they do all day long. And it's these partnerships that are allowing us to have a system to get ahead of the distribution as it's coming to us. So it's really important for our community to know this isn't happening everywhere, right? And you don't have to drive far to find where it's not happening at all. And so I would just offer, again, our thanks to Cayuga Health Systems for stepping in and on everything that we've done with COVID-19. And certainly vaccine has been no different.
Thank you, Frank, Jason, and Amy. We value the partnership deeply as well. And I think it's about serving the community. And so that is music to all of our ears. So thank you.
Thank you. Thank you both. Amy, I'm going to turn over the next series of questions to you.
As soon as I can find that mute button, and I knew Jason's mug says you are on mute. He's been waiting to share that. So we'll start with the next questions are really about the allocations. I think people have heard about the doses being allocated to different municipalities. So Frank, what is Tompkins County's allocation? And how is that, who comes up with that?
Sure. So this is unfolding differently than we have done in the past with, like, say, H1N1, and really how our plans had been designed, in that it's not county specific. It's really being done more on a regional basis. Dr. Stallone's organization its footprint isn't just in Tompkins County, right? So when the state is partnering with hospital systems to do vaccine administration, it's not about county allocation at that point. So really what they're looking at is, from a regional perspective, how can we get everyone in the phase that we're in vaccinated? Who are the partners that are ready to vaccinate? And can we get enough vaccine to them that they can get everyone that is interested in going to their site? So really we're in a show them what we can do. And I think the team has done an amazing job today and will tomorrow and Friday to show the state that we are ready, willing, and able to get vaccine into folks. So I would hope our vaccine allocation will match our ability to meet the capacity and demand in our community.
And as a follow-up to that, Dr. Stallone, how many doses have we received and how many have we administered so far?
So in total, we have come into possession of about 5,000 doses of the vaccine. Again, some of those were allocated to other institutions, and it's a kind of a statewide network, and we would be obligated to give individuals doses who came from other counties. By the end of this week, we will be at the 95 or higher distribution level. 95 or higher % of that 5,000 will have been distributed. And again, we watch the age of this, and we watch the purpose of it, and we are very agile and communicative with the health department to make sure we're giving as many people doses as we can.
Right, thank you. Frank, a big part of our community is college students. They may be scheduled to come back before they are vaccinated. And if that's the case, are they going to receive the vaccine here? And will we have enough vaccine for them to receive it here?
Yes to all of those questions. So the college students are going to be coming back soon. The spring semester is about to begin. There will be move-in plans being implemented over the next few weeks, and the college students will be back. I don't like talking about them like they're not part of our community. The higher education is the fabric of what makes Tompkins County what it is, and those college students are a part of it. And so, yes, they're going to come back. Yes, they're going to need to be vaccinated, and yes, we're going to vaccinate them. We're going to partner with our higher ed partners to make sure that they can help us get the vaccine administered. Allocations will come, and I would imagine for most college students that don't have an underlying health condition, they're going to be getting the vaccine when it's available to the general population. And by that point, we hope there's enough vaccine that's available for anyone who wants it. But yes to all of those questions, and those college students are a part of our community, and we're going to take care of them just as we would someone that's here year round.
And Frank, just a point that I think you've made before is, you're not taking a dose of vaccine from someone else. And I think that's a concern people have is, if people come from other communities to they may work here and take it, they're not going to be taking a dose from another person. We're going to distribute it as far and wide as we're able. As long as the vaccine's coming in, we're going to be putting it back out. So you're not taking it from someone. No,
absolutely not. And like we said, we're going to try to outpace the amount of vaccine that the state provides us and outpace the demand in our community. We're on our second day of pod. We have appointments tomorrow and Friday right now for people that are eligible. So no, we're not taking doses from anyone. We want everyone to get vaccinated. The bottleneck is going to be having enough people for us to put the vaccine in. So come out, get it when you're eligible. Doesn't matter who you are, where you live.
All right. So moving on to some of the reactions to the vaccine. Dr. Stallone, if there are medical concerns related to specific conditions or contraindications, will it be possible to request a specific vaccine?
Not through the current registration process as such. So we don't make it known that the Moderna or the Pfizer vaccine is going to be given on Wednesday. If there are specific medical conditions, and again, this should be made in consultation between a patient and their provider. So for instance, I think there's an enhanced warning with people with severe allergic conditions with the Moderna vaccine, and that could be taken into consideration, but that would be arrangements made through the patient's provider in conjunction with the distribution system. Not easy and not able for the patients the members of the community to navigate it themselves based on an advertisement of this vaccine on this day, but an accommodation would be made in consultation with a provider.
Okay. And a little tangential to that is if a person doesn't currently have a medical provider, where should they go if they have these questions?
We do have a physician referral line, and we'll make that very clear on the website. We can kind of work with you guys to put that up. I know on site, we have a provider who's there to handle in the moment medical conditions. That is no substitute for having a primary care provider. And I encourage everyone in the community to have a PCP relationship so that when questions come up, there is that relationship that you can draw upon. But we can make that clear. And I do think this is an opportunity as the health system is forward facing to the community to make the appeal to have that PCP relationship. That is good medical practice and always a good recommendation.
All right, thank you. Frank, if someone would like to wait for approval for a non-RNA based vaccine, will the public at some point be able to kind of call the health department and decide where they want to go and how to choose their vaccine?
First, I would say don't wait. If you're eligible, get vaccinated. That's what we need. That's how we're going to move forward. That's how we're going to get back to normal. The answer to will they be able to call the health department and pick? Probably not. I would imagine that as long as the health department is involved in doing these points of dispensing, it's because there's limited amount of vaccines and we're doing targeted populations, and we'll be doing pods based on the vaccine available at that point. As far as when it gets more broader, the broader general population, and perhaps the pharmacies are involved, or perhaps your primary care provider might have vaccine at that point, you could certainly then talk to those providers about what vaccine they might be providing, and you might have an opportunity then to pick and choose, but that is a long ways in the future. We really need everyone that's eligible to come out and get the vaccine that's available. As we've talked about, we're confident that they're safe, they're highly effective, and they're what are going to protect our community, those most vulnerable amongst us, and are going to allow us to get back to normal as quick as possible.
And Frank, you keep saying the word pod. Can you explain briefly what that is?
Sure, I'm sorry. Pod is a point of dispensing. It's just a term that we use in our planning. I also said medical countermeasure. That's another term that we use in planning. Medical countermeasure is anything from a vaccine to an antibiotic that we're providing to a large population in an emergency setting. So we have a medical countermeasure that we distribute in a point of dispensing.
Thanks, Frank. Dr. Stallone, what steps are in place to protect individuals who may have allergic reactions when their time comes to get vaccinated?
So consultation with a provider would be important to know that this is a risk if people have that history. There are medications that can be taken in anticipation. We have reactive measures at the site. I think, people have asked me a lot about EpiPens and this and that. That's never a prophylactic preventative measure. That is always reactive. And so if someone does have a history of allergic reactions, we've got good allergy and immunology practices in the network that they can consult if the PCP can't answer the question directly. So my answer again and again would be talk to your doctor about this and make the plan.
Great. I'm going to move into some eligibility questions with kind of the caveat that we got a lot of very specific questions, people asking kind of that first, I started off with this, which phase am I in? So I'm going to go through some of these phases just so people understand where they may or may not be, with the caveat that things may shift as well. So Frank, will non-healthcare essential workers be eligible for vaccine in phase 2? And how do they go about that?
Sure, it'll be phase 1B is when essential workers are. We don't yet know what the definition of essential worker is. We've said that. We will know when we move to that phase, and we will make sure that everyone is aware. And then we would direct them to our website to see first when that expands and who's included, and then also to register for the next available pod.
So locally, we have apartment complexes for seniors ages 62 and older. When those residents are eligible for the vaccine, which whatever phase that may be, would we be bringing the clinic on site to them, or would that be arranged? How would that happen?
So there's a couple of parts to that. The first is we need everyone who can to come to the pod at the mall. As we've said, that's the most efficient and effective way for us to get the most people vaccinated in the quickest amount of time. If someone lives in senior housing and they're able to go to their other doctor's appointments, they should be able to also come to our pod and get vaccinated. So we would encourage folks to start thinking about it in that way, right? That if they're able to, then they can. For those that might not be able to, and we talked about non-ambulatory, certainly the nursing homes are already a priority, and there's a federal and state plan. The governor talked recently about the state augmenting the federal plan to move that forward quicker. So we're going to them in those instances. And then as this evolves, if availability and capacity allows, if there are certain segments of the population that can't get to where we're distributing the vaccine, we will absolutely develop plans on how we can appropriately get the vaccine to them.
All right, thank you for that. As a follow-up, we talked a lot about documentation and those kinds of things. If someone doesn't have documentation, maybe, in a different phase, how is that going to be handled?
Are we referring to documentation about their eligibility?
Yes.
Yeah, so I'm hopeful that we're going to move away from this documentation phase. As Dr. Stallone said, it really is a limiting factor, and it's not really super effective. We need to rely on people being honest. They're going to attest. People that are registering now are attesting that they are currently eligible. It is a requirement. They're asked again when they get to the pod because we review those questions with them. So they're attesting a second time. That's really what we need to rely on, is people being honest about their eligibility into the process. Obviously, if the state continues to have requirements for documentation, we'll learn what those are. And as soon as we know, we'll make sure that we communicate that broadly so people are aware what they might need to bring.
All right. As we move into the people who teach and are teachers who are essential workers, do college professors fall into that category? Because it says teachers, which is very broad, but would college professors fall into that?
I don't know. I wish I had these answers. I know we've gotten so many emails and phone calls. I think everyone that's ever met me has called to find out where they are in line. And if I knew, I promise you I would tell you. We just don't know yet. We have to rely on the state as they begin to update and provide more detail. And they have been providing detail every step of the way as we've moved through this. So it will come. Please be patient. We will make sure we get it out as widely as possible so folks know when they're eligible.
So do you want Jason and I to stop giving out your phone number to our friends and family?
Please do. Thank you.
on that, the teachers piece, this question came in, and I'll actually kick it over you to Dr. Stallone. As schools are going back to in-person, do you believe teachers should get the vaccine before they go back? And is this something that can be determined at a local level?
I'll punt on the determination because Frank's the medical authority for the county, but I mean, yes, I think that teachers should, just like I think I'm going to take the same line that Frank said, is I want everyone vaccinated. And teachers, because they come into contact with large numbers of students, even though the schools are doing a great job of putting infection control procedures in place, and school spread has been minimal in our experience, it would be plausible and encourage for teachers to be vaccinated universally, along with everybody else.
Great.
Yeah, I don't know that the supply, just pragmatically, is going to be in time for schools to return. So if the question is a rearrangement of the phases locally, I would doubt that would be able to happen, just pragmatically. That's not me speaking normatively. I wish we had the vaccine to give, and if we had it, we'd give it, but I don't see the state allowing that. Frank?
Yeah, I would concur. With the who is eligible is being dictated by the state. We're required to follow that, and we will, as soon as it's available, we'll get it to everyone that we can.
And so one more category, Frank, farm workers. They've been named in phase 1B as essential to our food system. We have a large percentage of farm workers in the county. What is our plan to get these workers vaccinated?
Sure. Well, they will be eligible, and we will be trying to get them to the pod at the mall. We will obviously work with our community partners that interact with farm workers to get the word out and make us aware if there's any barriers to them making it to get vaccinated. But the same as we will with every population, once they become eligible, we'll get word out through all of the mechanisms that we have, and we'll rely on our community to help us make sure that those folks can get to the vaccination site.
Thank you. Dr. Stallone, how can Hopkins County residents help speed up the rate of vaccinations in our county? We're really facing one of the largest challenges that we've faced in really our generation. So how do people volunteer or get involved to help with this?
I think that's a great question. I agree that this is the challenge of our generation. I think there's the personal duty to get the vaccine when it becomes your turn, so to speak. I think that we have still a fair number of individuals who decline it, amazingly, given the safety profile and everything that we're saying. We lament that fact, but that is a real reality. So stories, giving your story. We actually at the vaccine site have effectively a photo op that people can take their photo and post it and convince friends and learn about the vaccine and communicate that. I think that's true. As we mentioned earlier, there will be a time when we call upon volunteers, retired medical professionals and nurses, and those who have the ability to potentially be vaccinators to step up and help with that effort. And there's always the opportunity, if you're motivated and you like the mission that you're seeing, to become a volunteer in other respects and help the medical community. The work and the effort is fungible in many ways, that if you're helping in one part, that can free up nurses and other medical professionals to do other kinds of work. So we welcome volunteers through the hospital and health system. And again, that might be a nice thing that we can put on the county website and our website to encourage volunteerism. I think that would be fantastic.
All right, thank you. Jason, I'm going to jump to you with another question. How do we get our local, county, state, and federal government agencies to coordinate together to more effectively protect us?
So I think it's a good question, and I think one thing that I've taken away, at least from this conversation, and I've been part of it, is the great relationship we have with CHS. So our local health department, our county government, working hand in hand with our local health system and our community hospital. That's a key component, and that relationship is critical to making this happen for our individuals and our residents, and that's there. It's been there since the beginning of this, which I think is a huge benefit to this community. I also want to say that we're regularly, from a county perspective, I, as a county administrator, regularly speak with town supervisors and mayors on a biweekly basis. We give them updates. We have regular conversations at least every other week collectively as to what's going on. Weekly, Frank is, and Dr. Sloan, probably much more than me, is on the phone daily with our regional and state Department of Health officials and other state officials to help in the coordination. We are communicating regularly with our region, which is the vaccination hub, in terms of coordinating this. And while we don't necessarily have direct communication with our federal representatives, we know our state folks are. So, I don't want folks to feel that it is not working effectively. It can always work better. But I do feel that, what happened today with 700 vaccinations is remarkable for this region. We have been labeled as a leader in this because of the great relationships we have. I think early on, we realized that relationships are critically important, whether it's with our healthcare system, whether it's with our higher ed communities, Cornell, Ithaca College, and TC3, and what they've been able to do to get their students here safely in the fall and in the spring. So we continue to build on those relationships, and that's the key to really making this work effectively.
Thank you, Jason. We're coming in on the end of our questions. Dr. Stallone, how is the information tracked on how many vaccines have been distributed? So you mentioned it earlier, but how are we tracking that?
There is an intricate web of systems that we operate within, and the vaccination data ends up in a system called NICIS, New York State Immunization Information System, I think. And is that good, Frank? But there's the CDMS, people register in CDMS, and then we register them in Meditech, and then there's NICIS, and we have down to the person and the number, how many vaccines we administered and distributed. I was a little loose on the number and said 5,000 because we're actively in the process of receiving and distributing. And so I had a rough number by the end of the week, and that's that 95% of 5,000, but we'll know right down to the last actual dose. This is carefully tracked.
And on kind of knowing what's going on, Frank, will the health department be setting up a dashboard providing daily updates and expectations for when people will receive their vaccine in the various groups?
Well, I hope this question came in before we launched our vaccine webpage, because it is pretty comprehensive. We're updating it almost in the moment as we get more information. There's quick links to register. There's quick links to the state eligibility system that they've put up. So I hope folks will find the website useful for knowing when to get vaccinated. If the question was more about to what Dr. Stallone was just referencing, kind of like our daily chart about disease cases, something similar around how many folks have been vaccinated. That is a goal of ours. I'd ask for some patience. We're in day 2 of doing this, outside of the hospital. And so, we're still figuring this out. Our focus has been solely on getting the vaccine into as many people as possible. We will get there where we'll be able to share some more detailed information about that. Just please be patient with us as we continue to work through it.
Well, thank you all for all of your responses to these questions. We're really closing in at the end of our session. I think you've all brought a lot of continued patience conversation here for our community. That's what's really brought us to kind of the phase we're in right now, is that we've developed patience as well as communication and support of one another. And I think Jason mentioned this, it's about relationships. I have been in a lot of calls with all 3 of you where we talk about the gratitude we have for the way our community is coming together to kind of meet this crisis as one. And so I think as we move forward, that's going to be very crucial and key to what we're doing, is just to continue on. And it's not just continuing on beyond, the pandemic. Eventually that will, hopefully, with everything we're pulling together, we're seeing that light at the end of the tunnel, but then actually continuing on in lots of new ways. So there's a lot of possibilities and potential here. With everything that you guys have talked about tonight, would each of you like to provide some closing remarks? And Frank, I'll start with you.
Thanks, Amy. Yeah, again, I want to appreciate the hospital system. I want to appreciate our community. I want to appreciate the people on the ground, from the health department staff to the hospital staff that are they're probably still there wrapping up today's vaccinations, and they're going to be there at 6 o'clock tomorrow morning to start over again. And then on Friday, amazing people. And I just want to make sure that we as a community continue to appreciate what we have here, because we are different. And I would argue that we're special because we're able to do the things that we do here in Tompkins County. So please, please be patient with us, and please continue to appreciate the level of work that's going in to make this available. And then probably the most important thing, please get vaccinated. If you are eligible, sign up and get vaccinated. I promise you, we, Dr. Stallone, the health department at Cayuga Health Systems, all of our teams are working to make sure we can have this vaccine available to you as soon as possible. We need you to return the favor, right? Come out, get the vaccine, protect the people around us that might not get it right away, protect those most vulnerable amongst us, and let's get through this. Let's get everybody vaccinated and move forward.
And over to you, Dr. Stallone.
Sure. Thank you, Amy. First of all, I appreciated the opportunity to participate in this. I think this was really well done with the questions between Jason and Amy, so thank you. On behalf of Cayuga Health System, we are honored to play the role that we do. We deeply value the partnership with the health department, but also the myriad partners we have in the community. This really does take a village. With respect to our role, our job is to serve the community. We are dedicated to being an available and capable hospital when that is needed. We hope it's not, but we are ready to manage the demand. And then with respect to the vaccinations, we're committed to staying ahead of the process, and we appreciate the investments and the loyalty that we're feeling from our community. And I agree with the sentiment that Frank expressed, that this is special in throughout upstate New York. This is a community resource. Our health system is yours, and we're dedicated to meeting your expectations. And we're very proud to be in the position that we're in. So thank you very much for that. And I also want to thank our staff, who I know for a fact, because I was getting texts during this event, that they are still working. And when we go to bed at night, there'll be nurses hard at work taking care of patients in our hospital, and they're there for you. So thank you very much.
Thank you, Dr. Stallone. And Jason.
Well, first of all, I want to thank Dr. Stallone for joining us. Frank, thank you for joining us. Amy, thanks for helping moderate and ask the questions. And thank you for the public that tuned into this. I think we were well over 1,000 people watching just tonight. And all of you that asked questions, hopefully we're able to ask them. If you have more questions, please feel free to ask us. We'll get back to you as quickly as we can. Really, just I can't say enough. I definitely can't speak to the public health perspective like Frank can, or providing healthcare like Dr. Stallone can. And what I can say is continue to follow those guidelines as vigilant as you can. Continue to protect each other. Wear your mask to protect me, and I wear my mask to protect you. Pay attention to the phases. When your phase comes up, we want you to get vaccinated. Talk to your friends, talk to your family, come in and get vaccinated. And for all of you that we work with through community networks, we want to do the best we can to reach all aspects of our community. So bear with us as we continue to build trust in the community, continue to educate the community, and help us communicate this out to all our members of our community in different populations. We want to make this accessible to all our members as quickly and as easy as we can. So thank you all again. Amy, thank you so much. And thank everyone for tuning in. And I just also want to give a shout out to Dominic Reiki, our communications director, who's behind the scenes, always making this work. So thank you, Dom.
Well, thank you.